Hi everyone, it's Alexandra here with MDPen, and today I wanted to talk all about seniors and folks with mature skin and how they can do MDPen and Endymed treatments. Please feel free to ask questions in the comments. Last month was actually Gorgeous Grandma Day, and I did miss that, so I did want to do something pertaining to seniors for today's video, as well as really anyone that falls in that dry, mature skin category. Um, so yes, please do participate with, of course, seniors, mature skin in particular. Common concerns can definitely be dryness. Of course, you're going to have more fine lines and wrinkles because you have even more decreased collagen and elasticity during this stage of life. And these can be top concerns. One thing I do want to say to those of you that are watching as professionals, you absolutely need to know your contraindications, and you will learn those being trained by MDPen. You will be given all of that information and knowledge. Keep in mind that when we're talking about Endymed, we're bringing in the element of radio frequency. So a big thing you have to check for are going to be metal implants. And you do want to know, of course, if the person has a defibrillator or a pacemaker. This is going to be very important. So if you don't already have intake forms that are very specific, I highly recommend that you get that. Here I do want to show you some of the top hand pieces I will be discussing today and recommending for mature skin. Again, make sure you know all the contraindications. As we age, there's more things that could come into play with our health. So this is going to be very important. On the left there, you will see fractional skin resurfacing, the FSR handpiece. In the middle, you have the classic intensive, which is the RF microneedling handpiece. And these two handpieces, middle and left, do require numbing. The one on the right is our iFine handpiece. You can see that nice small size makes you able to reach the eye area very well. You could treat upper lids, infraorbital area, and all of those places in their entirety. Of course, you can also reach small areas like the upper lip, and it can be handy for things like that too. So these are some of the facial hand pieces I would definitely recommend for seniors and mature skin. Keep in mind these treatments can, be 2 to 3 times the price of regular microneedling, and make sure that you're working within their budget. You don't want to put anyone out, farther than they should be. So for some, they're trying to spend more minimal with their cash. You may want to go the route of regular MDPen microneedling, but if the budget is there for that senior, they can definitely consider the RF treatments. If you want more information on these devices, of course, you can use our website. You can call us. For professionals, there is a schedule link right on the website where you can talk to a device specialist for these treatments. So question. Hi, Anne. What is the ideal interval treatment sessions for seniors undergoing Endymed RF or MDPen therapies to achieve optimal results? So the number of treatments won't vary too much from the usual. They may need an extra treatment tagged on there. So someone that might typically get, 2 to 3 Endymed treatments, you may have a senior wanting to do 4 for their mature skin. However, I will say with mature skin types, people with dry skin that isn't quite as resilient and bounce back, I know we teach to come in once a month or every 4 weeks for these RF microneedling or regular microneedling services. But with seniors and mature skin, it's okay to go to that 6-week mark. So you can definitely do the treatments at 6 weeks apart. When it comes to that iFine handpiece I was showing you guys, as well as the other RF handpieces, so the iFine being the one on the right, These are very non-invasive. These do not require numbing. These have no downtime. And this is a weekly treatment, even for mature skin and seniors. Of course, it can be paired at the time of FSR or regular microneedling. But yeah, don't feel like they have to come in right at that 1 month mark. You can always give those extra 2 weeks for optimal healing. Hi, Lori. Absolutely. You have to take into consideration their medications. I don't want to spend too much time focusing on contraindication, but it does blow my mind a little bit. And I don't consider myself necessarily the most conservative esthetician or skincare provider, but absolutely, you need to know all of this. You have to have very thorough intake forms for sure. Make sure they're off. Even if they're just temporarily sick, it's better not to do the treatment while someone is on antibiotics. Make sure they're off. Make sure you know if they're immunocompromised. I mean, I could get into all of this. High blood pressure. There's so many different elements. I see another question. Hi, Alex. Are there variations in treatment approaches for different types of mature skin issues, such as wrinkle, sagging, texture, when using Endymed and MDPen? Yeah. So if texture is a primary concern, which it really should be, I think we focus a lot on chasing lines and wrinkles, but there's been many studies done, and dermatologists will tell you this. If your goal is to look more youthful, or to look like your younger self, or to look as good as you feel, which is what a lot of seniors will say, I feel great, I want to look as good as I feel. It's very important that you're not just chasing fine lines and wrinkles, because when someone assesses your age or a sign of your youth, they do look a lot at your texture. They look a lot at your hyperpigmentation and dyschromia. These affect the way you're viewed more so than fine lines and wrinkles. That's why I always think it's okay to have some smile lines around the crow's feet. It's okay to have a little bit of an infraorbital. Once you overfill that area, that's when it can look funny. So yeah, it's so important to focus on texture and dyschromia. And this is where I'm really loving the addition of that FSR handpiece there on the left. This is your big textured tackle handpiece. And of course, the RF microneedling is going to be great as well for texture. So definitely bringing these two in, I would highly recommend. Great question. Thank you so much. I see more coming in. Hi, Sarah. Okay, can you discuss the level of discomfort or pain associated with these treatments for seniors, and what measures are taken to ensure their comfort during the process? Yeah, so it's absolutely vital that your patients be comfortable. You need to have a prescription strength numbing for these treatments, which you should be able to get because you should be a licensed professional to have these devices in the first place. So definitely a prescription strength numbing. You don't necessarily need to do a numbing block or anything like that. And yes, you don't want them to be uncomfortable. The two hand pieces on the left do require numbing. I will say the Endymed RF microneedling in particular differs from other RF microneedling devices on the market very much. These needles are non-insulated, tapered. So the energy, even though it's traveling along the length of the needle entirely, it's treating where it needs to. So it's giving that energy at the base, at the bottom of the needle where you're in that layer of skin at the dermis. And then of course, treating the epidermal layer, getting those nice texture changes, but you're not blowing through and treating all the layers on the way down at a high strength. And that's where things can get painful, if you've heard of that. All right. Hey, LinkedIn user. Okay, what are the differences in recovery and downtime for seniors undergoing Endymed versus MDPen treatments? Honestly, there's not going to be a huge major difference. When we say Endymed RF, this is very general. They make a lot of different hand pieces. The RF solo hand pieces, such as the I find on the right, aren't going to require any downtime. Again, the two on the left, these are actually, you know, penetrating through the skin. These require numbing, but the downtime's not going to differ much from an MDPen treatment. They should actually have less trauma, less bleeding, because you have that blood coagulating from the RF heat energy. So oftentimes there can be less downtime. I do recommend adding topical growth factors. Um, it's tough with PRP. You want to make sure the platelets you're getting are super great, super helpful. And if you're unsure of that, it's great to go the route of growth factors. I know exosomes are big right now as well. So you can do other things to definitely help decrease downtime with your seniors and with mature skin. Thank you guys so much for all your participation today. We also make skincare that is amazing for mature skin. I have to talk about this. If you're looking for a kit to use after RF or RF microneedling, or even regular MDPen microneedling, I would definitely recommend our NDI kit. That's ND like Endymed, ENDY, NDI kit. This is going to have 3 products that you're going to love. With after your treatment, it's going to have our Tighten and Lift serum in there, which is going to be great for healing. It sneaks in a tiny little bit of lactic acid as well, which is going to be such a gentle, nice alpha hydroxy acid for mature skin and seniors. It's going to have that nice growth factor gel in there. So definitely check out the NDI kit on our website. So definitely check out the NDI kit if you are someone getting RF microneedling, if you're a provider carrying it. This is all safe aftercare for your patients to use. It's going to be affordable for them. And again, you're making great changes in the skin. Thank you guys so much. See you guys then. Bye.